Hi, my name is Dr. Anj Singh and I'm an NHS doctor and a media medic. I'm going to take you through a series of common medical questions that people often ask me. In this video, we're going to discuss what you can do if you suffer from constipation. Now, constipation is the infrequent passage of firm stool and it can cause discomfort and pain. Sometimes it can be so bad that it can result in severe abdominal pain and even vomiting. The best treatment for constipation is actually to try and avoid getting it in the first place. So make sure that you've got a good and varied diet with plenty of fibre and plenty of fluid. If you are one of the people that suffers from constipation, unfortunately there are some things that you can do to help, but treatment can take some time, especially in children. Therapies for constipation can be divided, broadly speaking, into non-medical treatments and medical treatments. In the non-medical treatment group, first and foremost, we have diet. Diets are a major contributing factor in constipation, and it's always a good idea to make sure it has plenty of fruit, fibre and fluid. This will help make sure that the poo is soft and easy to pass. Secondly, exercise can actually be very useful. Moving around and keeping active can help move things along, especially in the gut. Thirdly, having a good toilet habit is useful, especially in children. Getting into the habit of going to the toilet regularly or after breakfast is a really good idea and encourages people to open their bowels, and that can make constipation less likely. This is especially important in children, and if you've got a child that's suffering from constipation and you're trying this technique, then maybe start a star chart to reward them for every time that they do manage to go. Now we're going to be moving on to the medical treatments for constipation, and also known as laxatives. Now the first group of laxatives are called softeners, for example Movicol or lactulose. Now these are designed to soften the stool itself and make it easier to pass. It's always a good idea before you try any other kind of constipation treatment is to try a softener, because before you move on you're going to need to make sure that the poo is soft before trying anything else. The second group of medications are called stimulants, and this includes Senokot and sodium docusate. Now these actually stimulate the gut to start working and encourage the stool to pass out. Obviously it's better if the stool is already soft in the first place, making it easier to pass. The final group of medications is enemas and suppositories, for example phosphate enemas and glycerin suppositories, and these are inserted into the anus and cause a local irritation and encourage the gut to start working and pass out the stool. As a last resort, there are surgical options available in severe or extremely severe constipation, and this is where you're admitted to hospital and put to sleep and the contents of the bowel are manually evacuated. Fortunately, surgery for constipation is quite rare. Now, it's essential to treat constipation early, especially in children, purely because it can lead to a vicious cycle. If your constipation is associated with being unwell or vomiting, then that's a sign that you need to see someone rather than treat yourself at home. If your baby is constipated, then speak to your GP or health visitor because they may need further investigation. And that's how you treat constipation.